I'm Dr. Marcus.
And I'm Dr. Onefator.
We're going to be discussing whiplash injuries from motor vehicle accidents today with you.
Yep, interesting topic.
Unfortunately, car accidents are very common, especially here in New York City, where drivers are a bit aggressive. Wouldn't you say so, Gene?
Yeah, definitely. Certainly, there's a bunch that we see here.
Okay, so the question is, how do you know if it's just going to go away on its own or if you need to seek medical attention? I would posit that you don't know, and so you should seek medical attention, unless you have no pain at all, because it's hard to really tell whether you have muscle pain, nerve pain, fracture pain, unless you're an experienced doctor.
Oh, and also we should probably talk about what happens in a car accident and what is a whiplash injury. So we have this little guy here. So you're buckled up usually, and you hit something or you abruptly stop, and what happens to your body is you're jolted forward, and then you jolted backwards. So your neck sustains this kind of a fast action sort of trauma. And some of the things that could happen, we were talking about that before. You could sustain ligament damage, right? You could sustain muscle tissue damage. If it's very severe and very traumatic, you could also herniate a disc.
And worst case scenario, I've even seen fractures from this, especially highway accidents. So what happens after a car accident? Usually the cops come and then they say, do you want us to call an ambulance? And a lot of times people go to the emergency room and they get some x-rays, usually. I've had patients come in to see me with x-rays that said they were normal, and then sent them back for MRI or CAT scan because I was suspicious that something else was going on, and come back positive for fractures, herniated discs, and things like that. So don't think that just because you have normal x-rays you're fine. If you're feeling a lot of pain and it's not reducing every day after the accident, definitely go see somebody who specializes in motor vehicle accidents.
Some of my experience that I've had, where I've had patients that came to physical therapy, after a car accident, and usually it follows a trend where immediately after the accident they're sort of okay, and I think it's probably like adrenaline, and they're still feeling like okay, and then as a few days go by, the pain tends to get a little bit worse, and I think it's just kind of their body catching up with what actually really happened to them. So I think that's actually an important point where, initially you might feel okay, but then 2 or 3 days later you might start to feel that pain, and then, it could be because if you have a fracture that's been not diagnosed, or an injury that's actually lingered quite a bit. So I agree with you. I think it's definitely important to really follow up. It's
right.
Especially if it's not getting better. If it is getting better, it's different, but if it's not getting better, certainly follow up.
Right. A few red flags that I'm going to mention to you that you should be especially concerned about. Number 1 on my list is loss of range of motion. So in the cases where I found fractures that people did not know about because they had only had x-rays done, they always could not move their neck fully. So if you cannot move your neck fully, definitely come in and get checked out. If you're feeling numbness going down your arm into your fingers or traveling to your shoulder blade, that's not normal. If you're feeling weakness in one of your hands or both of your arms, something like that, you have to come in and seek help. Those are the big red flags. Muscle soreness is normal and can go away, but if it's persistent, sharp, and severe, it can also be a sign of an underlying nerve root impingement from a disc. So these are all things that we screen for and do a full exam to look for.
And also, I guess we would also treat, but briefly, I guess what do we do in physical therapy for a neck strain or for a whiplash injury? Obviously, we want to just make sure that we can restore the full range of motion in the neck. Right? We want to make sure that the person can rotate their neck, turn their head. Once we restore the motion, of course, we deal with pain, so we try to manage their pain, and once that's established, then we could try to just re-strengthen and restabilize them so they could go back to driving a car or working in an office or doing whatever it is that they do for their work and life.
Yeah, I think the end goal is that we want to break the cycle of pain so that you don't end up with chronic pain after a motor vehicle accident. And from what we've seen and the success that we've had with the patients that we treated here, it's definitely possible with active mobilization, good medication management, ordering appropriate tests to figure out what's going on. we're able to really prevent people from ending up in that chronic cycle of pain, which is our end goal, and get them back to what they were doing before they were in car accidents.
So I think that's pretty much sums it up, right? I'm not sure what else we need to really tell people, but I think that's a good message. I think that's pretty simple. So unfortunately, if you are a person and you get into a car accident and you have some pain, seek attention. Don't just wait it out. Don't be afraid to ask the questions and make sure that the doctors are doing everything they're doing for you so that you are pain-free. Thanks so much for watching.
Yeah.
We're always here for you guys. Precision Care
All right.
Medical.
Hope that helps. Bye.
Bye.